We look at transparency. Is this really going to be more transparent? I believe Representative Atkins says this is going to be the most transparent agency in the state. How could we have any more transparency? Well, who is watching these folks? I looked at another state. Tried to look at as many states as I could to see what has already passed. And in other states, they have an outside auditor that comes in and audits the books and reports back to the legislature. That seemed like a good idea to me. I offered that up as an amendment. That was rejected. But you might want to think about that. You might want to think, who is actually watching these 7 folks? And let's talk about transparency and trust. Let's talk about trust, because we've got the best health care system in the country. We've got the best physicians in the country. We've got the best researchers in the country. And we don't trust them. We don't trust. Not one physician can be on this board that's going to decide how we're going to deliver health care in the state of Minnesota from henceforth. And you know, we're not supposed to talk about Obamacare, aka the ACA. We're not supposed to do that, but I'm just going to mention that because that's how we got this. It was passed at a federal level, not on a bipartisan basis, but on a partisan basis, rammed through with no Republican involvement, nothing reaching across the aisle. It was rammed through, paid a huge political price for the Democrats for doing so in 2010. Paid a huge price for doing that, paid a huge price for imposing on all of the country a health care system that we can no longer enforce, that's going to drive up our costs. So think about that, this came from. This came from Obamacare. This came from the ACA. It's imposed upon the state of Minnesota. And when President Obama rolled out the ACA in Chicago a few years ago, he talked to the delegates of the AMA, all the physicians that came and gathered in Chicago, his hometown. And he didn't say, you're the best physicians in the world, you are the standard of care for the world. He talked about how much better health care was in other countries. And that's what we're doing here. We're saying we know more than you do, doctors of the state of Minnesota, physicians, clinicians, research folks who come here from all over the world. We know better because we're legislators. You can't be on this board. There's a gentleman by the name of John Hicks. He's a doctor at HCMC. When the bridge collapsed, the people were brought out of the water. They were brought out in terrible condition. They were brought to HCMC. They didn't know what they were facing. They didn't know what kind of injuries they had. They had head trauma. They had surgeries. They did the best they could. They reacted with the best absolute training in the world. Nobody died at HCMC that was brought out of the water or off that bridge that day. And I talked to this gentleman, and I talked to a physician named Walter Glisich, who's a neurosurgeon who operated on patient after patient after patient after patient. Nobody died. And you know what they said? They said, Matt, everybody did their job. Everybody from the nurses, the paramedics, everybody did their job. They brought these patients here. Nobody died at HCMC. Everybody got treated. And it was an unbelievable feat and an unbelievable example of how these folks are ready for anything. They're the best in the world. They're the absolute best in the world. And we're saying to those folks, we don't trust you. Dr. Hicks, you can't be on this board because we don't trust you. Can you think of anybody in the state of Minnesota who's probably more qualified in terms of who should get care and how we're going to get care and how we're going to deliver care than these folks? Do you really think that there's anyone else more qualified in the state of Minnesota? But we're saying, doctors, we don't trust you. We don't trust you. The same folks that built the best health care system in the country and in the world, that is the envy of the world, we're saying, we don't trust you. We don't trust you. Politicians can be on the board. Union members can be on the board. We understand health care. We can do this. We don't trust you. That's not a very good message to send forth to the people who've really built the best health care system in the country. I think we can do better.